everyone, welcome to Cancer Healing Journey Talks. Myself Sonali Modi from Community Outreach Team of ZenOnco.io and Love Heals Cancer. We guide cancer patients on adopting an integrative oncology treatment approach. We help them find the balance between medical treatment and complementary treatment therapies. We help our patients with our team of oncologists, lab experts, nutritionists, and other healthcare professionals so that we can improve the treatment outcome for patients. We also help in connecting patients with other cancer warriors who have gone through this journey to address their queries. And we also share inspirational journeys to motivate cancer warriors who are going through this journey currently. So firstly, I would like to introduce you to today's speaker, Ms. Renee Singh. She's a cancer warrior. I'm happy that you're here with us today to share your story. So over to you, Renee. Please start with the introduction.
Hi, Sonali. Thank you so much for giving me this opportunity. I'm also honored to share my journey to give more hope and motivation to everyone or every warrior also fighting the cancer battle.
Yeah. So, what type of diagnosis it was and what were the initial symptoms?
Okay, so Sonali, I was diagnosed with invasive lobular carcinoma in 2017 on the 4th of May. Invasive lobular carcinoma, it's a type of breast cancer. It begins in the milk-producing glands of the breast, and it was stage 2. So I had done a self-examination test, which I detected the lumps in my left breast. I was then referred to the Breast Foundation, a breast clinic, that then performed a biopsy. In my biopsy, I would have to wait for the results for a few weeks. And on the 4th of May, it was confirmed that it was invasive lobular carcinoma, the type of breast cancer, stage 2. I was then referred to the breast clinic, Professor Carol Ben, that did my examination. And I was then also told that on the 10th of July, that they would perform a left breast mastectomy and removal of my lymph node, of one lymph node at that time there. So that was done on the 10th of July, Sonali. And a few days later, I was also scheduled for a reconstruction of my breast on the 14th of July. However, I got sick, so I could not go into theater, and I didn't have any further reconstruction done from there. But after that, I would then proceed to my chemotherapy sessions and my radiation.
Yeah. So, what was your first reaction when you got to know that you're diagnosed with cancer, and how your family took this news?
Okay, so on the day of my first diagnosis, Sonali, like I said, when I had the biopsy results done and I had to wait. So on the 4th of May, I went into the Breast Foundation where I was now going to get my results. And at that very moment, when doctor confirmed it is positive and you do have breast cancer, I had a few tears in my eyes and I held onto my hubby's hand. And I just absorbed, for those few seconds or moment that, okay, I have breast cancer. I was then told to go to the counselors. The counselors are normally there at the foundation after your diagnosis and are always there for all the love and support towards this battle. And when we entered the counselor's room, the counselor spoke to me and she still asked me, "Are you sure, Renee, that you don't need any counseling?" And I was literally there for 3 minutes and I said, "No, I'm absolutely sure. I'm fine with it." And okay, I had left from there. But what I did, Sonali, when I got home, I've got 3 big kids, 2 boys and a girl, and I had to break this news to them and as a family. So I did do that, and everybody, stood with me there, love and support. But I also, at the same time, for 2 weeks, Sonali, I actually shut off the world, meaning it came to just being on the phone or social media. I wanted time just to absorb this whole diagnosis because nobody is educated on the cancer diagnosis. And this was my first experience prior to all my health history. A year before that, I had a full hysterectomy done due to some bleeding complications. Everything was clear. However, when I got this diagnosis, so this is cancer now we're talking about, and so I took that time to actually find out more and what was going to happen in this this journey. But nevertheless, I stayed positive. My family was there in support. And after 2 weeks, you know, obviously then I started like speaking more out to everybody there. So we stood together as a family, my husband, my 3 kids, and myself.
Yeah. So, like, what treatment did you underwent?
Okay, so the treatment I underwent was from August 2017 up until November 2017. I underwent chemotherapy doses. So that was my first treatment that I had, apart from the mastectomy. And then thereafter, I was scheduled for February 2018 for 31 days full radiation. But Sonali, in my radiation, I was there for 2 weeks, and the doctor, while I was in radiation, I felt a bit ill. My neck was a bit stiff. When I chatted to the prof in radiology, they stopped all radiation, and I was admitted because of a suspected swelling in my brain. So I was then admitted for 2 weeks in hospital, and I was on high doses of steroids for this suspected swelling in the brain. However, after 2 weeks, everything was clear, and I returned back to my full radiation program.
Yeah. So, like, chemotherapy is a very tough routine. So, can you share your experience, like how you coped with it and what are difficulties you faced during the treatment?
Okay, so chemotherapy, yes, for me personally, it was the biggest challenge of my life. Can you hear me, Sonali?
Yeah, I'm here.
You can hear me, yes. It was the biggest challenge of my life. Where it came to the chemotherapy, I had my doses, so I would go to hospital very early on that day. And during the session, well, for my first dose of chemotherapy, sitting in the chair and the nurse administering this dose of treatment, and the drip would go into the arm, and the first thing was, you know, the tingling feeling I would have from head to toe throughout my body. It was like pins and needles rushing through me when I would have the first dose. When I finished my treatment, I would still be okay up until midnight. Every time I had a treatment done, it comes to close to midnight, I would start feeling the nausea and start feeling a bit sick. And with our patients and warriors, we have a specific, there is a name for it, but it's a chemo that is more red in liquid. So that liquid and is known to patients and warriors right up until this very moment, Sonali, they call it the red devil. And why the red devil is because within 7 to 14 days of having this particular chemo, your hair falls off. So in chemotherapy doesn't mean your hair falls off in every treatment. So each patient is different. Sorry about that. Each patient is different in cancer. So even if you are the same diagnosis, you're not the same to your treatment, to your journey. So everything about it is different, even the treatment you administered. And when I would get sick and the next morning would come, Sonali, I would be continuously vomiting, and the nausea was so bad, but the vomiting, in a sense, it's not like a normal body compare as to being in the cancer body and having been under chemotherapy and vomiting. So you would rather feel so sick and very fussy about the smells around you. For me personally, I could smell like gases in the air while I vomited, and it drained me completely, Sonali. But it was a very big challenge, and after 5 days, the body would stabilize a bit, but you were very weak in this time, absolutely weak, not eating properly, and just the limbs and the body just couldn't make it. But I still picked myself up, and with my support from my family, and I said, Lord, you know, the challenge is right in front of me. I'm going to stay positive. I'm not going to give up in this battle. And no matter, I got through my chemotherapy session. So it was a very challenging time through the chemo treatments, and just having to vomit or throw up, you know, so many times, and being on medication and the body being weak. So this was the first time my body had been through a tremendous challenge, you know, when it came to treatment wise medically. And but I got through my chemo doses.
Yeah. So how many chemotherapy cycles you went through?
I went through all in total from Jan to November. Mine was a total of 4.
Okay, 4. Yeah. So, you know, during such times, it's very important to have a sound support system, be it visiting the oncologist or be it staying at home, you always need a support
Yes,
that basically motivates and encourages you. So who was your support
yes.
system along with the family?
Okay, so as I had my family, and I've mentioned, yes, they till this very moment they've been my support system in my in my journey. Sorry, Sonali, I got a bit of a cold.
Yeah, it's okay.
Just a bit of a cold. Sorry about that. Um, as well as my oncologist at that very moment was Dr. P. Naika, who is also an oncologist, has his practice at Donald Gordon. I
Mm.
was at the Charlotte Makeke Academic Hospital. At the same time, going for each treatment and sessions, I also started, to speak more to survivors and patients that were around me. And from there, started educating myself, gaining more knowledge on the diagnosis and then the support system, because in cancer, the challenges compared to the normal body now would be more than what you would experience being outside the cancer body. So I also at that moment got a lot of support from survivors to patients to I've also in contact with many people up until this day with different foundations, to support groups, which I have my own today as well, because I'm also a founder of Warriors with the Purpose organization. I also do motivation and counseling, so that also led me to where I am today, just having the support system at that very moment, hearing from patients that survived it, that are fighting the battle, and there are many, many challenges that made me stronger and gave me a better support system coming from my family and them out there. So you're never alone in this cancer battle from the onset.
Yeah. So how did you manage your emotional well-being during those times?
Emotionally, Sonali, I thank God till this day. Emotionally, we are all human beings. So you're going to have a breakdown. You will. On your first diagnosis, I did have one breakdown. Fortunately, only one. But through it all, what motivated me, Sonali, emotionally was at that very moment, my second born son, he's now 21. He was actually chosen as the head boy of his high school in his metric year, in the 2017 year, and he was going on to study Bachelor of Accounting degree. So he gained a bursary, he gained a Saturday school program, and was very motivating because at that time I was under my chemotherapy sessions, and he was in a Saturday school program. He studied, towards gaining this entrance into university, and everything was his education. My daughter was a bit younger. My eldest son was working at that time. So my kids as well motivated me. And no matter how I dealt with emotionally, compared to before the cancer body and being in the cancer body, again, are two separate worlds. So while I was in the cancer body, I had to now focus on my health. Firstly, looking at stress, emotional stress, and just emotionally, you giving up wasn't good at all for the body to get better and for me to heal. So I also at the same time gave my kids support, which they gave me support, and I carried on fighting harder every second minute a moment, every day, the challenges that came with my treatments or how my body felt. My kids lifted me up, I lifted my kids, and I focused. Today my son has finished his third year. This last few weeks he finished his third year of Bachelor of Accounting. He's got his degree now in being an accountant. He goes to honors next year, and then after that will be his 3 years in articles. And my daughter is completing her metric. She's doing a homeschooling program. She's going to finish matric now, and my son as well is working. So that has been amazing, just staying positive. Your mental state of mind, Sonali, from that
Yeah.
very moment that I took it into as an individual, saying, I'm going to stay positive. I know, everybody that gets diagnosed, the first thing that comes to your mind is that cancer is a death sentence, and it's not. And at the same time, also, you're picturing yourself, you're going to be wearing one of these hospital outfits, and you're just like giving up, and you don't know, where to turn to and what's going to happen. So all these things, yes, went through my mind. And again, as being a mother and a wife, and also being now in this cancer battle, I need to fight harder. I'm not going to accept defeat, and I'm just just going to fight harder and look forward. So, you know, this is what got me through as well.
Yes, definitely. Very well said. Because having a positive mindset will ultimately help you to recover faster.
Yes,
So, yeah.
correct.
So, what do you think that people need to expect from this cancer type?
Okay, in cancer, Sonali, it's important that where it comes to cancer, it can be any type of cancer. I'm a breast cancer survivor. It can become to any of the other cancer diagnosis. No cancer patient in this diagnosis is the same. So anybody, be it as long as you've been diagnosed with cancer, it's important to know that if you and the next person have the same diagnosis, everything will be different from your diagnosis to your treatment to your whole journey. It's a very challenging battle, a journey that needs a lot of good support system. So that is making the families understand what to expect from their loved ones through this journey and through this battle. So again, when it comes to medical or administering your treatments, the oncologist will do their best, radiology will do their best, as well as your surgery. And then when it comes to support system, we have support groups. So we're always together in this battle. So any advice and any support that we can give throughout this journey, there's always that support. So you're never alone in this battle. That's what I do myself, you know, creating more awareness, giving more hope. And in this battle, yes, you have to expect the unexpected, Sonali. It's a very challenging battle from the onset of your diagnosis right through, but again, maintaining that positive state of mind, your loved one as well, keeping them in an important, like, positive environment, not a negative environment. It's very, very imperative at this time in a cancer journey, because stress is also the cause of reoccurrence. In survivorship, even though I'm a survivor, I have my many challenges as well. So cancer can reoccur, Sonali. Like for instance, myself, I'm on a menopause injection, which induces menopause and also works with my treatment, which is tamoxifen, because I'm high risk. So that is also why I need to have this on every 3 months. I have the injection, and then I have tamoxifen on a daily basis for it to also work against the cancer cells from reoccurring. So reoccurrence is very high in patients. So as long as you've been diagnosed with cancer, it's important as well that when it comes to oncologist or oncology and radiation, as a patient, whatever you're not certain or sure about, it's important that you need to write these notes down. And when you do have your appointment, you put this forward to the oncologist, because you have all right, and you can't be not certain or not knowing what is my diagnosis, what stage am I in, what treatments are going to be administered to me. So again, every individual is different. So as family as well, it's important that they also get education, and that's what we are there for with our NPOs as survivors. We want to educate you more on the diagnosis, because you know, just being diagnosed with cancer and not being educated won't help you in this journey. So it's important education wise for the family and for the individual to know where they are in their journey. It's very, very important, and even the challenges and what to do, the do's and the don'ts. And because of just your loved one or me being in that cancer shoes, it is so important, because at that very moment, Sonali, you a cancer patient can be okay, and in the very next minutes or moments get very ill, and you don't know what to do or what to expect from that. So you know, there's many, many challenges, and you have to take it day by day, but always again moving forward. And if anything also changes in your in the journey to a patient, a loved one, they have to seek medical attention immediately and not take it into their own hands. It's important that you always seek medical attention if a person is not well at all, be it the pain especially. Pain can become very severe, Sonali, in the cancer journey. And always, yes, there is natural things to reach out to. For instance, when we look at our cannabis, it doesn't cure cancer, but it helps to maintain pain. It helps you
Yes.
sleep better. So managing the pain, Sonali, is the most important thing where it comes to your worst case. Your prognosis is worse, and your cancer has spread to different parts of the body. You know, that's what I'm saying. Again, now, to everybody out there and listeners that there is always hope, there's always support in this, and you're never alone. So you are not going to do this on your own or fight on your own. The help is going to come from every warrior around you, because that's what we look at. We want to give hope, we want to give motivation, support, to know that you can beat cancer. So even though when you hear the word cancer, no, it's not a death sentence. You can beat it. There is support in many ways. It depends on what the patient's needs are, you know, in every angle. So coming from my side as well, I did get, you know, all that support, and that's why today, Sonali, I have also, I'm an NPO, registered NPO, Warriors with a Purpose. I'm the founder, because creating cancer awareness, motivation, counseling, support, education, reaching out to everyone fighting this battle. And that's what we need, is giving each other more inspiration and motivation through this journey, helping the patient become stronger in this journey, no matter the challenges and each patient faces, no matter what cancer it is as well, Sonali.
So like, did you made any lifestyle changes during or after the treatment?
Yes, you know, Sonali, like many things, or should I say, before the treatment, it was completely a different world altogether. And that's what I look at it today. Because from the time of my diagnosis, and I remember my one aunt telling me that no matter your diagnosis and the challenges, that cancer is going to change your life. And yes, Sonali, I agree 100% today that cancer actually changes your life in many ways, Sonali, as an individual, as a mom, as a wife, as a warrior today. Many things have changed my perception in life, and it's making me want to just fight harder in life, live every second, minute, and moment in life. Because, as I said, even with me being complete in like my treatments and being in survivorship, I still have to fight for my life, Sonali, because cancer is meaningful life. When I say that, is that I still have to undergo treatments. I still have treatments that I have to have for over a 5 to 10 year period as well. I have to go for checkups all the time. So even lifestyle wise, Sonali, it's not an expensive lifestyle. It's implementing a little bit extra natural things and living properly on a daily lifestyle as well. You know, my heart is with cancer. So that's what it's changed me as well, because as an individual today, I give all my time, love, and support to everybody fighting this battle. I have a support group. I do awareness drives. I do events of raising, you know, more awareness, especially in communities, underprivileged areas. So it's changed me as an individual, where, you know, I want to now keep on fighting harder with the warriors, and even, you know, praying for a possible cure for cancer one day, you know. So yes, it has changed me in many ways. Even my family, of me just interacting also with my patients, newly diagnosed and survivors, and myself as well, you know. So yes, this is what it's done for me.
Yeah, so every crisis in life teaches you a particular lesson. So what life lessons has
Yes.
this cancer journey taught you?
Oh, this cancer journey has taught me to appreciate life more. My main point, Sonali, being appreciate every second, minute, and moment that you are breathing and you are alive. No matter the challenges in your life, we can't always control everything. And that's what I've learned. We can't control it. I was diagnosed with breast cancer. I couldn't stop it. I couldn't control it there. But as long as we are breathing, we must take that opportunity to fight harder, pick up our swords, fight harder, no matter what the battlefield looks like, be it cancer or anything in life.
Yes. So like, what was your first reaction when your reports were finally showing that you're cancer free?
Oh, I was overwhelmed. I was very, very excited, tears of joy. Just hearing the oncologist say to me, "You are now in remission." You know, so I was like so excited. It's just the feeling. It's so hard to explain at that moment when you are now cancer free. radiation has worked, chemotherapy has worked, your mastectomy was done. So everything, you are now free of cancer, and you've done it. You have conquered, you've won this battle, you beat cancer. So that was really amazing news to my ears and to my family and to people, friends as well, that heard that news. And yes, that's when I committed also more my life towards the cancer battle and those fighting this battle.
Yeah. So, like, do you still go for prescribed checkups after that?
Yes, yes. So Sonali, for basically the rest of your life, you will have to have, like, I'm scheduled for the 14th of December. Monday, I'm going for a mammogram. So a yearly mammogram I have to have done. Then I have my menopause injection every 3 months, as well as my tablets I take on a daily basis. So checkups is important, and self-examination tests on your body is very, very important. As a female, there's male breast cancer as well, Sonali. So males and female, it's very, very vital and important. Of males can do the self-examination test. The signs are similar, but with women, it's important that you do it, especially after a 7-day menstrual cycle. It's important that you do a self-examination check as well. From below, above the arm, from the armpit, with 3 fingers stroking down to the breast, back and forth, detecting any lumps, because that as well, you need to seek medical attention immediately should you pick up any lump within your breast as well, coming from a breast cancer survivor.
Mm. Yeah. So, gratitude seems to be the biggest strength to fight the situation. So, what were you ever so grateful for that made you always calm down after thinking or revisiting that memory?
I think, just God, the main thing, God, Sonali, the prayers, faith. You don't live by sight, you live by faith, just knowing, live every second, minute, and moment, because it's a challenge, yes, but, God, through it all, I held into God's hand right up until this very moment, Sonali. I thank God and only God for even the challenges, and yes, keeping where I had to stay calm, where I had to deal with it, and I had no control over it, be it treatments to the whole cancer journey. It was God, and I thank Him today for that, for this journey, and for even my life, up until this day, and even handling things much better now than even then before. So even though the challenges now, I can still even handle it better, because God was I held on so tightly to God's hand, and I said, you walk with me this journey, and that's what I've done till this very day.
Yeah. So, how is your life after cancer?
It's been amazing. I'm, no complaints. I wake up every day. Yes, I have my challenges where, sometimes my body feels different. I might have a pain in my back, a migraine, because chemotherapy and radiation, Sonali, has a very, very big impact on one's health and one's body. It can take up to many years for the body to come right. So I have my challenges on a daily basis in my body, and like the flu, I had my both vaccines done. So I have to have my Pfizer vaccines done, and I just picked up a slight cough from last week. It was very hot, extremely hot conditions here, so I got a bit of the flu, and I see the influenza in SA is a bit high at this very moment. So yes.
Mm. Yeah. So, an act of kindness you will never forget.
Sorry.
An act of kindness you will never forget.
No, not at all. Just being there for the next person in this battle and in this journey. The main thing, love and support throughout this journey, is so important. So all the time. It's, you just being there for the next. I had a patient yesterday approach me from Donald Gordon, and she was diagnosed in July, and her baby turned 3 months 2 days ago. And Sonali, she reached out to me on Facebook, and I hadn't seen the message. And yesterday, telling me she's also diagnosed with breast cancer. And immediately I spoke to her and I gave her my number. She sent me a WhatsApp message. I added her onto my support group, and you know the amount of support that came out of it, and told there were warriors that even told her, you know, you're on the best group, because just us going through this battle and journey, and you overcoming it, being cancer free, you just have to be there for the next person in kindness and in love.
Yeah. So how do you relax or calm down yourself?
It's very hard, Sonali. When it comes to that, basically, okay, yes, with cannabis oils, you know, you'll have it when you're going to sleep. Basically, it's a very challenging, when I say challenging, from the time you diagnose up until this very moment, your sleeping patterns differ. So you don't sleep like you would before. Yes, you do have medication that the doctors can administer, but I'm a person that I don't want to have or to depend on sleeping pills in order for me to sleep. So I get my day by, Sonali, by waking up between 4 and 4:30 a.m. on a daily basis, and then I pray. So God is the first thing of my day, to start my day. And after that, you know, have my breakfast, because I have this nausea problem and vomiting since I was diagnosed. So I have my toast and a cup of coffee, and then I proceed to my support groups is my first thing. You know, so I have to interact with them. So that keeps me busy throughout the day, and I'm busy with other organizations. I'm busy with more awareness drives and events. I've got something for next week, Friday, at the Charlotte Muteke Academic Hospital, where I'm going to be handing out gifts and having some little treats, and some other warriors joining me. So I'm busy on a daily basis, which keeps me occupied, keeps me calm. Sometimes, you know, we have to go out as well to hospitals, or have Zoom meetings as well. And then being a mother and being a wife at the same time, doing my house chores, you know, having to cook as well. So all of that, and with my kids, giving them the support in their education, helps me through my day and maintain that calmness and knowing that God is in control all the time.
Yeah. So when did you think that I can beat this disease, or was this belief always there with you?
It was in my treatments as it progressed, and I think it was radiation, Sonali, that I felt much stronger. Radiation literally is 5 minutes that you would lay on the bench, on that bed, and have it done, and I would fall off to sleep every time, because I was there, the first patient in government hospitals. The queues tend to be long, so I would be there before 4:45 in the morning. And when I finished, so I would go in. So after 8, going on to 8:30, I would be done. And when I get into the car and traveling home, I would fall asleep. But every day when I got home and I woke up, as soon as I got off the car, I would then go straight to my chores. That means going and cleaning my house. And my mom would look at me, and my mom is going to be 75, look at me and say, you know, for the first time in her life, she's seen somebody that's come out of radiation day in, day out, want to clean the house and continue life. And slowly, every day of that treatment, it made me stronger. I felt different each day because of my mental, positive mind saying, I'm going to stay positive. I'm going to fight harder. No matter these challenges, I know I can beat this. So every day I came home from radiation and attended to my chores, and just being the mom and wife I had to be, of having to clean the house, cook something for my family, no matter how much they would want to do it. I, up until this very day, still do the same thing, you know, of getting the house clean, doing the spring cleaning, cooking for them, making the rotis, making the curries, everything, you know, that they want, and just being that mom and wife. So that also gave me more strength and support, and my family support, knowing I can do this, I can beat it. Yes, cancer is such a big thing, and I'm halfway through my radiation, but I'm going to do it. And even through the steroids, Sonali, my body picked up muscle and weight. So it was a very tremendous challenge in my life, just having steroids, looking at the guys going to gyms, you know, and I was a bit strong at that moment. And I had to overcome that, because that came with also its side effects, you know, having your mood swings and just this weight on your body and muscle. So those were the challenges, and especially my vomiting was so bad, even though I had tablets, but I always suffered with this vomiting. And I thought to myself, myself, but every time I went through my worst, I came out of it. So I'm going to do this. And that's how, maintaining that positive mindset got me through beating cancer.
Yeah. So what do you think are the stigmas attached to cancer and the importance of awareness for it?
Sonali, sorry again.
What do you think are the stigmas attached to cancer and the importance of awareness for it?
Okay, so when we look at cancer, Sonali, about 64% is hereditary. Whilst you're looking at, if you have an individual has a BRCA1 gene and BRCA2 gene mutation, they are also then prone to getting cancer. And that's what we're looking at today, is a lot of them with this gene mutation is been diagnosed with cancer. And the importance here now is doing your self-examination test where it comes to breast cancer. And coming from me as a breast cancer survivor, like I explained, your self-examination test, where you need to also go to the doctor immediately, detecting any lump on your breast, going to your doctor, having a full examination, having your yearly mammogram done is also of importance, Sonali, in this diagnosis, so that the doctor then can advise you best, especially early detection. Early detection means picking up that cancer much earlier in your body than a later stage when the prognosis is now worse and it's going to spread to different parts of your body. And we have different types of breast cancer as well. And the prognosis can get worse. You can get very, very sick. So again, it is important maintaining that, like I said, for women after 7 days menstrual cycle, detecting any lumps in your breast, as well as just doing your self-examination, picking up any lumps there as well, and immediately going and visiting your doctor or oncologist. They will advise you best. Now you have picked up the lump. So again, early detection saves your life in this cancer diagnosis.
Mm. So what is that one thing, what message you would want to give to other cancer patients and caregivers?
Okay, firstly, there is hope. There's lots and lots of hope in this battle. There's support in this battle. You're never alone in this battle. And always remember, in this challenging battle, never to give up, never to look back. Always look forward, keep moving forward, maintain a positive environment within your family where you stay at home, even if you are working. Always have positive thoughts. There's support groups, that there's warriors that are always there. Whatever advice that you need, and it's always a person that has been through the cancer journey and battle that can relate to a newly diagnosed patient. And you never give up. Never give up is not an option. You don't give up no matter what you're going to face in this battle. Each patient is different. So you put your head up high, you keep on fighting harder on that battlefield, and you never give up. Every second, minute, and moment that you are blessed with life and in this journey, you thank God for it, you hold on to God, and you tell God to take full control of every challenge, and you look forward again and never give up.
Yeah. So if you have to sum up your journey in one sentence, then what would that be?
If I had to, in one, I would say hope, faith, and love. The three main things: hope, faith, and love.
Yeah. Your story is really inspiring. And I hope
Thank you.
I hope this session really motivates people out there who have traveled or who have been traveling through this journey. So it was lovely having you here today on this session with us, Renee. So once again, thank you so much.
Thank you, Sonali. Also, I'm really honored and for having this opportunity to give more hope and motivation to everyone fighting this battle. Thank you so much, you guys.